Good afternoon from Bali, everyone. It's Hanifa Menon from hearthealthbrainhealth.com, encouraging healthy grieving and mindful actions. Today, I wanted to talk about healthcare and alchemy, and healthcare specifically, because we know that in so many different organizations, buildings, offices, organizations, healthcare is part of an entire structure. So the healthcare of everyone working in a particular place, and certainly healthcare, whether in a physician's home or in their practice, is so important in terms of the care that patients get. And so I thought I'd start with this first quotation by Paracelsus. And it says, although alchemy has now fallen into contempt and is even considered a thing of the past, the physician should not be influenced by such judgments. The physician should not be influenced by such judgments. This is interesting because it is a judgment, and as soon as I think, well, that's not going to help anything, I don't even try. And if I think, well, what if it might help? Let me give it a try. It opens a window to possibility. And alchemy, again, this idea, it is a very old idea. It is something that I kind of opened up speaking about in the last video. I wanted to share this quotation about, or definition of, what is alchemy. And this is from the Mind's Journal site. It says, changing the frequency of thought, altering the harmonics of matter, and applying the element of love to create a desired result. Let's think about those things. Changing the frequency of thought, So we do know that the higher frequencies of thought is a conscious intention for kindness, compassion, generosity, caring. And these are very much part of what a physician or healthcare is looked upon as potentially being able to provide. Now, of course, in our world today, there is a collective unconscious energy which is affecting physicians and healthcare and much of our world. And in that, we're not often thinking about, where is my thought now? How about now? How about now? How about now? And as healthcare practitioners or providers of any sort, or even family members who are also providing healthcare to each other in the family, we do not think that what I'm thinking might affect another. So if I'm thinking about my worries about yesterday, or sharing at the office, this is what I don't feel so good today, that is a frequency of thought that's not very helpful. It's not a high vibrational energy. And unless we're actually consciously aware that we are actually emitting that into the world, we don't watch our thoughts. Then there's the harmonics of matter. And if we think about how rushed we are today, so in healthcare, anywhere which is providing healthcare, so whether it's a parent to a child, or a child to a parent, or a nurse to a client, or a naturopathic doctor to a colleague, it doesn't matter. Wherever we are applying healthcare, our thoughts matter, and how we are interacting with each other actually matters. So how do I stand next to the person I'm speaking with? How do I sit? And we know we learn this in healthcare courses. Oftentimes, most healthcare professionals have understood how to place themselves with clients and what would be the most comfortable and most open for communication. And then, of course, there's the functionality of, well, this makes it more comfortable for me, or I need to have this much space, or I like to have more space between myself and the client, or whichever way it is. But is it a warm and welcoming space wherever that space is? Is there eye contact? Because there are a lot of practitioners that are so caught up in needing to write the excessive notes that are almost demanded by government, legalities, all of that sort of idea, that it's not often that healthcare practitioners are spending time to have meaningful eye-to-eye contact. And we know that this is a very healing space for people. Lots of clients have spoken to me about other practitioners they've worked with who didn't look at them through the entire appointment, or sometimes looked away when they didn't want to say something very good in terms of, this is what I think you've got going on. And we would all do this when we've got something not so comfortable to share with a friend, a family member, or a colleague. It's not easy, and it's not easy for a healthcare practitioner to look at a client or patient in the eyes to tell them some news. That's not so easy. Yet, this is our role in terms of healthcare, and so the harmonics of matter matters. It matters. And so how we're looking at someone, how we're speaking with someone, how we're engaging with someone, how we're not ruffling through files, or we're not looking at our phones and computers, even if that's where we're taking notes, that our engagement is with the actual client is so important. And then applying the element of love. Love, again, this is not the love that many people would think of as like a passionate love, a romantic love, which is absolutely not appropriate in a healthcare setting, as we know. Yet there is this genuine love, this authentic love that really cares for the client, that wants to see success in the client, that wants to see healing in the client, that wants to see a smile on the client's face. It could be as simple as that. And we need all of these to create a desired result. And oftentimes we have lost sight of these things. And unless we bring it to our conscious attention, we don't actually promote ourselves in utilizing these manners. And I do call them manners because I think it is manners. These are compassionate manners to have with one another, and especially if we're in the healthcare industry or world, this is so important as to how our clients are feeling. And right now, as we know in all industries right now, everything is rushed. The roads are rushed, the offices are rushed, the mental space is rushed, everything is rushed. And that is not a space for alchemy. So today I would like to encourage you to take some time to first reflect on these things before you begin your day, and try to apply these three things that are able to provide an alchemy for healing for clients. I thought I'd share this quotation, which I thought was really great. This quotation says, "What if, through the alchemy of these two words, something new comes into the world?" So often healthcare practitioners, as well as clients themselves, and of course family of clients, looks at lab results today that this is what it is, or this is what you better face. And I look at it and I think, oh boy, now, my history, I actually have a history that included work in a medical lab, and I looked at a lot of tests coming through this lab, and we looked at urine samples and blood samples and microbiology samples, and we would also see the false positives, we'd see the false negatives, and we'd also see when some of these items were also somehow contaminated, which also potentially gave the false positive, false negative, often went back to the medical doctor and had to be retested with the client. So I'm aware of that sort of background. So I do know that anytime clients, for my experience, have received a result that's not so good in lab work, my first question is, do we need to repeat the test to make sure that the test is okay and the same result is coming up now? And of course, with increasing healthcare costs and oftentimes people needing to pay for lab tests, this isn't often a common thing to retest for some result that has already come through. And what's also not regular or common is for a practitioner to look at results and wonder these questions. What if this isn't correct? What if you're going to be healing, even though most of the clients that I've seen have not healed when they have these numbers? So whatever they're looking at in whichever number, these two words, what if, is part of the alchemy. What if you might get better even though I'm seeing these numbers? What if that opens doors to possibilities and starts to allow us to utilize this principle or this thought or this creation of alchemy in changing something. And remember, we're changing our thought to help create the results that we desire for our clients, for ourselves, for our life, for our world. And this is kind of an important aspect that has been forgotten by many. I finally want to finish with one more quotation, which is by Carl Jung, and it says, "The highest and most decisive experience of all is to be alone with one's own self, or whatever else one chooses to call the objectivity of the psyche. The patient must be alone if he is to find out what it is that supports him when he can no longer support himself. Only this experience can give him an indestructible foundation." Indestructible foundation. And guess what? Here I am talking about mental health, and so often people feel very broken, and who's there for me, and how will I get through this, are the thoughts that are going through. And when people are forced to be on their own in those spaces, there's a beautiful potential of healing and rising beyond the space that that client or the patient or yourself are in. This is important for us to remember in healthcare because we have forgotten to share this detail with clients. We tell them, take this medicine, eat this food, have this much sleep, don't talk about this, don't watch social media. We say all of the things that are objective and outside of the client, and this is something that many clients are doing that themselves anyways. If someone is very anxious, if someone is quite depressive, sad, grief-stricken, worried, all of those spaces push people into themselves, and they feel very alone in those spaces. And for us to even plant the seed that, you know what, see what it is that's supporting you in this time where you feel you've got nothing else. I hope that you will reflect on these ideas. I'll have a couple more of these videos too about the alchemy, and especially related to healthcare, because I think healthcare affects everything. And I do know that it's time to focus on mental health. We know we've been doing this for quite a bit of time, but the reason I'm focusing right now, it just so happens that May is Mental Health Awareness Month, and I know we're in April, so I am just a little ahead of the game. But who's counting? Time and space, as you know, for this mind don't mean that much. Yet I will say that there's no time like now. Today, please do sit for 5 minutes after this video perhaps and reflect on these ideas and see if you are applying this in your interactions with others. I wish you this for the best healthcare flowing through you, for you, and for the world around us. I wish you a fabulous day ahead, and I hope you remember, transform your mind and transform your life. Have a great day or night, everyone.